Hello and welcome to new episode of our EuroHealth podcast. My name is Jan Klusacek and our guest today is Professor and Head of Department of Allergy, Pulmonary Disease and Internal Medicine at the Central Clinical Hospital of the Ministry of Interior and Administration in Warsaw, as well as President of the Polish Society of Public Health and member of the Executive Board of European Public Health Association, Professor Andrzej Mariusz Fal. Welcome.
Good afternoon. Thank you for inviting me and thank you for this kind presentation.
So we are meeting at the time when topic number one in all media is the new Omicron variant of COVID-19, and I can hardly start with anything else. What do you think that this new variant will mean for us, for the necessary regulations and provisions that our governments impose on us?
Well, for the past 2 years, we kind of playing a game with this guy called SARS-CoV-2 virus, and in my opinion, he just scored because the Omicron variant that we all know about, which is why it's say brand new in this case, it's been found in early November in Botswana. And why I think the virus scored during this game right now, because this is the first variant from the very beginning of Delta where we have, for starters, a lot of different changes. So it's over 50 mutations in this new variant. Most of them are located in the spike protein that we know that it's a key to enter the human cell. So potentially, well, we need to observe it, of course, but potentially it's a very potent variant that may really change a lot. Of course, we need to observe how very contagious is it as compared to the Delta that's the leading in Europe right now. Of course, we need to look at the symptoms. We need to look at how severe disease will be developed after infection with this new variant. But what is very important is that this variant fills a gap that we've been talking about for a while already, because we are all excited about the numbers of people being vaccinated in Europe, which is pretty understandable. We would like to have 75-85% in vaccination, but we know that there is not such a country, and our countries, especially I'm talking about Poland, are really low in these numbers. But caring of that, we very often forget about those countries that are absolutely not vaccinated. Let's say Africa, let's say Botswana. They become a kind of reservoirs for the virus, where the virus can infect people because, first of all, they are not vaccinated. Secondly, they can be non-competent in the name of the immune system, because AIDS it's a big plague down there. So in this case, these people not vaccinated could cause well, let's say with the playing terminology, a golf course for the virus, where the virus can infect, mutate, and create new, potentially very, very bad variants that then will be re-exported to Europe, United States. And as long as the vaccines that we're using here are protecting us against the new variants, well, we fine. But if the changes continue, if we have such variants with 50 plus different mutations, at some point we'll find a virus that will possibly be absolutely not well-looking or absolutely resistant to the immunity that we are building. What I mean to say is that even though we need to work more on our societies to convince people who are skeptical to make them still go and get their injection, get their jab, But we need to support financially and organizationally also countries who cannot financially afford buying vaccines for their inhabitants. It's not only humanity, it's also well understood our own business to do so.
And do you think that current vaccines will still work with the new variant? Do we have any data yet?
No, we do not have no data about Omicron. As I said, it's a baby that's 3 weeks or 4 weeks old, so we don't know anything about this variant. Especially, we do not know how really it's gonna be affected by the immunity that we have due to the vaccines we're using.
You are known as a strong supporter of vaccination. What do you reply to people who are anti-vaccines and say, well, now or in maybe a couple of months we'll have a new variant that will be resistant to current vaccines, and then you will be in the same hole as with all your 3 jabs as are us who did not get any. So,
first of all, we are not so much surprised that we waiting every year to listen when the WHO says what influenza viruses we'll be using for the jets this autumn, which is pretty normal. That virus changes, virus mutates. So the same happens to the coronavirus, but it's a younger virus, so it mutates faster. It affected already 300 million people in the globe, so it had a very, very good place to mutate. When some skeptic people approach me saying, what you just suggested, okay, well, a new mutation approaches, and you with your 3 jets will be at the same point as we are, who never got inoculated. Well, this is not true, because first of all, not all of the skeptics will live long enough to look at that, because when we look at the 4th wave, not only in Poland, not only in Czechia, but all over the world, we have now patients who are very severely ill and who are dying that are otherwise quite healthy young people. Healthy, I mean 30, 40, 50 years old, who never had any chronic diseases, but they are dying just because of the COVID disease, just because they haven't got their immunity well. So they haven't got vaccinated. So this is one thing I can tell them, those who are still skeptical. Come to my hospital, come to my clinic. I'll show you young people who refused to get vaccinated when they could, and well, now for them it's a little bit too late. So this is one thing. And the second thing about the new variants that possibly would escape the antibodies that we are producing after vaccination. Well, okay. That's why I'm glad that we have a new technology. The mRNA technology allows us to make new vaccines within 2 or 3 months. We have to understand that if not this virus, so the viruses will be, and they already are, a part of our environment. The 20th century was a century of the influenza virus. It started with the Spanish flu after the First World War. We had 25 or 26 endemics and semi-pandemics of influenza in the 20th century. As we see the 21st century, we have already the 3rd very important worldwide pandemic caused by the coronaviruses. We had the SARS-CoV-1, then we had the MERS, now we have SARS-CoV-2. So no doubt the viruses are going, and the viral diseases are going to stay with us, are going to pose a very major threat to the public health, and we better get used to being vaccinated, and we better find the technologies that allow us to react early.
And what is the situation in Poland with vaccination? For example, well, in Czech Republic, we are still lacking behind well, not only Portugal, but many, let's say, old EU countries. Is it the same in Poland?
Yes, in Poland we have the same problem. We have around 60% people vaccinated, and even worse than that, we have only 1% or 1.5% of those who are who started vaccinating. So those who are freshly convinced and decided to vaccinate. I think that I'm always against using fear in telling people what they should do, but I think that people looking around and seeing what's happening with those who are not vaccinated, well, at least some of them will go and get their vaccines. But this is not the best way. Well, it works, but I would prefer them to listen to what we say, the doctors, the scientists. This will be fine if they could discuss with us and get convinced and go get their vaccines. Well, that's nice, but even if they go to get their vaccines because they are afraid, well, it's better than if they do not go at all.
And do you think that the situation could be somewhat changed by implementation of or coming to the market of new types of vaccine? I mean, there is this mRNA vaccines. There were first, then there were the vector vaccines, but we are discussing a vaccine that was prepared in a more traditional way, and maybe some people are still afraid that, let's say, mRNA is too cutting-edge technology, and maybe they would be more comfortable with something more traditional.
Oh, absolutely. We have 3 different technologies present and accepted right now in Europe for the SARS-CoV-2 vaccines. And, well, the choice, thanks God, the choice we have, and the wise choice should be made by every one of us. I use the instance of mRNA vaccines because, well, they will be the ones who can produce new products, who introduce new products much faster than those with the other technologies. But once the products are introduced, of course, the choice should be free between them 3 because they're all active.
And what about vaccination of children between 5 and 11 or 12, which was much discussed? Some people believe that since they are quite safe again. It's
hot news. Well, it's a decision of EMA that was a couple of days ago, but this is quite natural. And I was, and most of us doctors and scientists were expecting this decision, just because when we look at what happens when we vaccinate first the elderly, then the adults, youth and then children become at more risk. So it's quite natural that the virus goes the easiest way, and the easiest way is to try to get those not vaccinated. So when we started vaccinating the population, we started from the elderly because they were at the highest risk. Then we went to the adults. Now we're moving to children because they are at the lowest risk. Yeah, that's true, but the lowest isn't 0.
Well, we have the word Euro in the name of our podcast, so I must ask whether you think that there should be something more done by, let's say, European Commission when talking about the pandemics. Are they doing enough?
Well, I think that pandemics will learn us and will show to the Commission that healthcare policy should be more European, because, well, this very important issue has been left almost in 100% to the member countries. And I think that the movements that we notice recently, the Union Against Cancer, and as well as some actions during the pandemic, are showing that acting together is much better. So if we have common social policies for Europe, why shouldn't we have common health policy? And I think and I hope that with all the bad things that the pandemic brought to us, this will be one of the benefits that will arise after pandemics.
Okay, and Well, what do you think that is the impact of pandemics on mental health and especially substance abuse? Do you think that it's somewhat connected?
Mental health is one of the four most complications after the COVID disease. First of all, it's lung fibrosis, then we have heart fibrosis, then we have mental health, and then we have neurologic issues. So these four are the most common. Of course, we have also several other sufferings or several other worsening of chronic conditions that are connected with the COVID-19 disease, but the four mentioned are those most important, and really the psychiatric changes, the psychiatric patients are among the most affected, because when we see that first fear, that's a very important issue for many of us, for many of those, especially at the first wave of COVID, when it was absolutely unknown and we feared most, I think, at that time. Secondly, isolation. You don't socialize, you don't have the regular relations. It has to impact your psyche,
and especially for
the children and the young ones. Of course, yes. I don't know to what extent, because I'm not the specialist in this field. But I'm absolutely positive, and I see it also already when I look at the patients that are coming to us, also young patients, because one of the outpatient departments is allergy. So this is the clinic of relatively younger people.
And do you think that when I mentioned substance abuse, do you think that people started to drink more, to smoke more, to, let's say, alleviate the stress?
Oh yes, this is true. When we look at the reports, I'm very familiar with the reports about Poland, somehow less familiar with other countries. But when we needed to look at the Nielsen report about alcohol consumption in Poland, we started spending much more on alcohol during the pandemic, although we're not drinking more. So as we used to drink as a society, roughly 11.5 liter of pure ethanol a year. So we still keep drinking that much, but many more people, up to 30% drinkers, confessed that they were binge drinking during pandemic, which is very important. It is very bad because 11 liters per capita is not a huge result. I mean, this is the average European, I would say, but 30% of people being at least once binge drinking, this is already a big threat to public health, or to their health, of course, but to public health in general. Secondly, we gained some weight. We gained 6 kilo weight per person in Poland. That's quite a huge gain. And we started buying
not only
cheaper food. We started buying cheaper food in general, and we, for most of the time, we didn't have opportunity, or we didn't want to practice ice, we didn't run, we didn't bike. The effect is we are by 6 kilo heavier, which is also a threat to metabolic diseases, to cardiac diseases, and so on and so forth. And finally, thirdly, we smoke as we did, but this is a very good thing that might arise. Some of us reached for the, let's say, heat-not-burn products or other products, not because they were so convinced they are better, but they were closed in small spaces with other people, so they were forced to. And this is the good part about it, because this is harm reduction.
At least something good came out of it.
I'm trying to catch up with small good things. So this is the second. The first one is a common European health policy, which is a huge thing, and this one is also a good thing. Maybe pandemics brings us closer to harm reduction, at least in cigarette smoking.
Well, when you mentioned harm reduction, it's a big topic that we are discussing in this podcast. So how is it in Poland? Is this, let's say, widely adopted policy towards the substance abuse?
Well, frankly speaking, not. Well, I hope it's gonna change, but it's gonna need a lot of work to have it changed. Simply everything that goes this way is being put to the same basket with the regular cigarettes, and convincing people that to some obvious things is sometimes very difficult. It's convincing people to go get injected, go get. So at this point, we see that. Let's say we have 100 patients who smoke. Only 5% of them can afford quitting smoking without any support. I mean, well, really keep that, because, well, there are many.
You can quit smoking
who
three times a day, but
yes, well, Mark Twain.
Yeah.
Well, nothing difficult. I did it thousands of times. So it's not this kind of quitting, I mean, but really quit smoking. It's 5% of them. Let's say when we use some psychotherapy, this increases to 15%. Then nicotine substitution. Well, we up to 35%. But at least 40% of the heavy smokers, lifetime smokers, sit in my doctor's office and say, well, doc, I'm not interested. I need a cigarette. Well, and these are the people, the only people we should advise to go to the harm reduction techniques. I know the counter arguments. Well, nobody is saying these are healthy products. No, they're not. But harm reduction is not giving very healthy things. But, well, if you may use it healthier, less harmful. This is the only thing we are suggesting.
And is there any country in EU that could be used as a role model for those harm reduction policies?
I don't think that we have such a leader. There are several countries who are really looking deep into the harm reduction. I have a deep admiration to the British system, NICE, of recommendation. And Britain used to be, one of the countries that was showing that harm reduction should be introduced by doctors, should be introduced by nurses. There's nothing shameful in it. Simply do it right, do it properly. Prepare yourself, learn yourself what is it, and then teach your patient.
Okay, and why do you think that this approach is not really widely adopted by politicians, by the leading government officials? Is it because it's not so politically attractive as a zero tobacco policy and ban that and, let's say, put heavy pressure on smokers and hunt them out?
This is one of the reasons. Zero smoke environment, well, is absolutely correct. Nobody will object. Nobody will tell you that you're, going or blinking to the cigarette manufacturers or you're doing something bad. But this is only one reason. Second reason is that in case of Poland, the budget gets around 10 billion euros in taxes. Most of all, excise tax yearly from the cigarette business. So simply sometimes we cannot afford losing this money.
Even if it could be, let's say, outweighed by healthier citizens. And
but this comes in 20 years and you need money the next year.
Yes, that's most definitely.
So looking at this from the perspective of public health, of course, zero tolerance for smoke is the goal. But this goal, in my opinion, can be reached only at the so-called primordial prevention. So teaching, education, education, teaching. We need to start with children and be very consequent for 20 years. After that, possibly, we'll have almost no smoking societies. No smoking is one. I think that 1 number digits is fine, because I don't remember in the story of the humankind any of the cultures that wasn't drinking or smoking something. So even being an optimist, I'd say that having 3 or 5% smokers in a society would be a very, very good result. But this is, as I said, a 20-year-long goal, and we need to start it now, and we need to start the primordial education. But at the same time, we cannot leave those who are already smokers. So these are the two things, the two ways to go, but they're not alternatives. We need to go them both at the same time.
And what about European Commission? Do they support harm reduction for smokers?
As you know, yes and no. At the same time, they do support, saying, okay, we need to have the harm reduction policy. But secondly, they do not encourage member countries, member states to go this way. That's why I think we started about the common or more coherent European health policy, because, well, this is also health policy. This is public health. Behavioral damages, such like alcohol, sweets, salt, smoking. This is the most important long-term threat. I think that even more important than the infectious diseases to the public health. Look, we now, not after 2 years of pandemics, well, almost 2 years of pandemics, we have 6 million dead people. But during the same time, over 80 million around the world died prematurely because of the NCDs, non-communicable chronic diseases. So we cannot say that we're fighting only infectious diseases, and we already forgot the non-communicable diseases. Again, these are the two ways, and we need to go them both.
There is a huge discussion at the European level and also in the member states about what role play flavors when we are talking about tobacco products. Well, there are some people who say that they should be banned because it makes those products more attractive to youngsters.
I do agree. If it makes really very attractive to youngsters, well, this has to be taken under supervision, maybe even banned. But first of all, as I remember, all countries in the European Union have a very strict law that these products cannot be sold to youngsters. So, well, why do we talking about it? So, is something not working in these countries?
That's a very good question. Well, I feel that I have children just underage that is relevant for that, and but I see that their slightly older peers, for them it's the smoking of cigarettes is considered like uncool. But using those flavored products is that is kind of cool. Many like TikTokers, etc. It's part of their lifestyle. So maybe it should be this should be topic for the national governments to address.
Being very serious now, yes, I do think and I do agree that flavors, colorful boxes should be banned.
Okay, that's pretty straightforward answer. So in about a week there will be the discussion or voting at the European level, European Parliament's BCA committee, and what do you think will be the most important topics on that?
Well, I hope at this level we not going kill again the harm reduction attitude, because this is the thing that is helping many people in the country who applied this attitude, and I think that should be implemented in other countries just to leave some choice to those who really refuse to quit smoking. We had the drug problem, we have methadone. We had the alcohol problem, we have 0% beer. So why don't we have anything for those who are smokers, who are dependent on nicotine, who are refusing to cooperate or are refusing to get any knowledge that will make them cooperate? Well, we discussing with the vacciners, well, trying to help them, to show the way, and we are not discussing and we are not showing the way those anti-quitters, smokers. Well, let's help them.
Okay. Well, you mentioned in a long term, you mentioned education. But I think that these days, if you ask anybody on the street if smoking is good for their health, everyone knows that it's not. Yet they are still smoking. So how this approach could be, let's say, changed to simply accepting the fact, it's not healthy. Well, I'm drinking as well, and I'm eating unhealthy food as well. So, well, I'll probably die. What's that? So.
Yes, everyone in the street knows that smoking is bad, but most of them are convinced, well, yeah, I know, yeah. Well, if I smoke, I'll then have this cough, you know. Most of them still, even though these are the communications, the pictures on the boxes, right? They still don't trust that this is really due to cigarettes. First of all. And the second, you know, if you are just listening to that and you are being convinced by someone else that this is really bad for you, but you like it, it's always like with the thief that wants to open the bank. Well, this is illegal. I may be caught, but maybe it works. Maybe I'm not getting caught. Maybe it's not me who's gonna be sick. Yeah. So people simply, if not educated, but only given the fact that you may get sick, it's not that they understand that 80% of those smokers have smaller or bigger disease. If they do not understand this is not a full education. That's why it doesn't work. And secondly, a part of education is also a social attitude too. So if we educate the full society, starting with small children, that smoking is bad, a smoker is not our friend, then it works for them. Will be natural for them not to smoke. Really, it's I know it's difficult to quit smoking once you start. So the only way to get the zero tolerance, to get the zero smoke environment, is to start here and now with the children so that they'll never start smoking. Once a smoker, always a smoker. Maybe this is not true, but for at least 50%, it's very true. Even 5 years or 6 years being not a smoker, a successful quitter, you grab a cigarette, you grab a pack, you're back.
Yeah, this is pretty much similar with the alcohol addiction, right?
Well, this is dependency. It's the same physical and physiological mechanism.
And maybe it's even about not seeing smoking as widely acceptable part of the adult world, right? When I was a kid, it was perfectly normal to see doctors in their offices with cigarettes. That's most definitely not the case today.
Oh, frankly, yeah. When I was a young doctor, we were 6 in the same office in the hospital, and the 5 of us were smoking.
Yeah, but that's not what.
But this was a long time ago. The last dinosaurs were still in the streets.
But let's connect the two topics that we discussed today. Because I think that there is a third positive thing on the whole COVID situation, and it is more importance that is given to general health of the person, to prevention, to healthy lifestyle. That because people see that, of course, young sportsmen die due to COVID as well, but it's much that there is much higher risk if you are overweight and have various connected diseases, don't you think?
Absolutely, yes. But this also needs education. Even though it's very visible, you're saying, oh, everybody sees, which is not true.
Yeah.
You're looking and not seeing. You're only looking at this. You're not seeing that. So we need to make social campaigns showing that, pointing it out, and then it's education. Because, once again, well, okay, he died. Well, maybe he was sick. I don't know. Maybe he was. Who says he wasn't? So we need to work on the cases you just picked up. We need to say, okay, the lifestyle saved him. Say, lifestyle saved 90%. Okay? Because, we have always the genetics standing behind. Then we have the external influence, and the genetics with the external influence, with the environment, creates phenotypes. And phenotypes are either, you're sick, you develop this disease, or you do not develop this disease. So we're not saying that the genetics does not influence your ability or your chance or your risk to develop chronic diseases. Yes, but this is only 10 to 15%. Over 50% is your lifestyle. This is so-called health fields of Lalonde. They have been published in the late 70s of the 20th century. And they are true until now. So this is a part of education to show people and to explain people how much they put at risk. Because they don't know it themselves.
Well, and what does the government? What can the government do with that? Why am I asking? It's my favorite question. Sometimes I have a colleague here who is very sporty type, so I like to ask our guests: is it fair that he pays the same percentage of his income on health insurance as me, who has, let's say, a long-term attraction towards sweet foods, etc.?
It's a very good question. But remember that we in Europe, we chose, no matter if we have a more German or more British system, we chose the public support of public financing of the healthcare systems. And I cannot find a way in a public system to make those who are let's say if the dependency, if being dependent on cigarette smoking is a disease, so we need to treat these people and not to make them pay. Well, at this attitude, of course, in my opinion as a doctor, they should be made to pay if they do not stop. Also those who do not come to the regular checkups. Every 2 or every 5 years, depending on the condition. If they do not show for a checkup, they are required to pay higher insurance premium. I do understand that, and I absolutely agree with that. But once again, we have the public financing, and it's very, very difficult to introduce it in Europe unless it's going to be a common European health policy. Then we can work on that, then we can cooperate, and then we come to our first subject of today's meeting, today's seminar. Why not to make politicians, first of all, to prepare acceptable regulations and rules in public health and health policy for the entire Europe?
Well, this is actually a very lively discussion these days in Czech Republic as well, since we are about to have a new government, and the matter of motivation is a
It's
huge
also a post-COVID change.
Well, this is post-election change, and I think that the COVID situation definitely contributed to the situation, because, well, I can think of hardly any government in EU that would be considered by the voters as successful, as fully successful in dealing with.
That's true in terms of COVID-19, but there are huge differences, though. I mean, I don't see a 100% successful government, but there are governments who are doing better and governments who are doing worse in this case. But we are talking about. You ask a question if the governments, European countries, or the EU itself do enough for the public health. I would say that no, we do not spend enough for the prevention. We therefore need to spend much more on the curative medicine, because we do not pay for preventing diseases. We do not pay for the prophylaxis. I think that much better cooperation between the non-governmental organizations and, well, financing from the public budget, well, putting these two things closer together than we do so far, could help the situations. Well, I understand that the prevention, the prophylaxis, is closer to the local governments and the non-governmental organizations. Yes, I do understand. I do agree. It should be their job more than the central government job, but the central government should finance it.
Well, maybe it's a similar situation to the taxation discussion we had previously. Spending
yes.
Money here and saving in a few years, right?
Absolutely, yes.
Okay, so thank you so much for your time. I think it was a really nice discussion, and I hope it's not the last time we see each other. Thank you.
Thank you so much.